First, I wanted to say that I'm a clinical nurse specialist and I'm working in a neurology department and also in a rehabilitation center. So all people that we see have a diagnosis of MS and are followed up for their DMT or for their rehabilitation or prehabilitation. And I find it so important, as MS is a chronic disease, that everybody is followed up on a regular basis, depending on their DMT every 3 to 6 months or so. And of course, MS is also a progressive disease. So it's important and to assess and check on a regular basis the abilities and the signs and symptoms of people that they are occurring. And of course, we also know that MS is a disease with an unpredictable course. So it's good to have some checklists and to have some guidelines. But of course, it's the most important thing that drives our consultation or our follow-up is the patient. And so patient-centered care is a thing that has to be really in center. But why is it that in our clinical practice often so difficult to recognize change that people are reporting? I think it's maybe a little bit out of the scope, but the shortage of staff is for me the biggest problem to start with. We have also the excessive administrative requirements and obligations. Even more and more will lead to even more time constraints. So it's quite money driven, of course, less nurses, more and more administrative requirements, and also a knowledge gap, especially more and more, and especially in our countries, we see that we have to work with new nurses who like to shift from one hospital to another, and then they're doing a little bit of urology, and then they're doing oncology, and then they're coming work in rehabilitation. And because of that gap of nurses, we have also interim nurses who are not acquainted and work with MS. And so it's quite important that the nurses who see the patients, that they are quite informed about the disease and recognizing symptoms or signs. And especially, of course, due to the specific characteristic of MS itself and to the unpredictable and uncertainty about the cause of MS. I have to mention also the systemic barriers like limited access to specialists, fragmented care coordination. I'm thinking of the insurance or reimbursement, and especially to the money, of course, and the inadequate electronic health record integration, and also maybe the limited multidisciplinary approach. In my perspective, what could be done for a better approach? First, again, the staff. The second thing that I want to mention is the knowledge. And the third thing is maybe rethinking our way of working. Nurses are specific, the one healthcare professional with a low threshold to patients. And we saw it even this morning in our sessions that often patients go to their neurologist and they get all kind of information and they come out and then they go in the office of the nurse and they say, oh, what did he say and what do I have to do? So repeating those things and the connection with our patient is so important, and also the connection via mail or via telephone. I think also we have to say that we have to expand. The more nurses that we have, the better support that we can give to patients. That is really a challenge. Especially when I'm talking about from my rehabilitation center, the stability, or if I can say it like that, the stability for the nurses. The longer the nurses stay, the more they are interested in the pathology and the better support that we can give to our patients. And then, of course, the increasing of the knowledge. And then the knowledge is something that we have to reassure for our patients themselves and working on health literacy, but especially also for the nurses, and find some solutions for the nurses to be informed and to get the right information on the right time, and the access to all kind of information, and regular and ongoing conversations with a person with MS, which is instrumental in identifying subtle signs and symptoms of progression. So to find out that, it's important that nurses are really good educated on a regular basis. The last thing that I wanted to mention is the way of working. And the way of working, of course, is quite broad, but I'm thinking of pre-consultation checklists if we want to capture change. If we want to capture something that is recognized by the patient, we have to find out different ways of working. So pre-consultation checklists, the patient-reported outcomes are so important, so we have to use them in our clinical practice. use general checklists to not skip signs or symptoms that can occur, but we have to ask on a regular basis our patients, do you have some problems occurring in your bladder, sexuality, and so on, topics that are not discussed quite often. And also, the task of nurses is assess our patient regularly, objectively, by doing tests like the 25-foot walk test, the 9-hole pack test, the SDMT, so functionality and cognition has to be assessed. And if needed, facilitate the approach to the multidisciplinary team, because with a whole team we can do better than we can do on our own. And in general, maybe I like to use the word triangulation. Triangulation is in fact just looking at a different side, and when I see this computer I see myself here, but when you see at the computer you don't see my picture, you see my picture over there. So triangulation is looking at a problem or from different ways. Then we can objectify, or then we can just feel the change a little bit better. We have to listen, of course, to the patient and taking that into account. We have to assess our patient objectively. We have to do MRIs. We have to do other kind of exams. And putting these puzzles together can help to have a better objective way and to really understand the change that the person is experiencing himself or herself. And I think the most important thing that I wanted to say here is that triangulation and of course the shortage of the nurses and the knowledge gap maybe. And MS Nurse Pro is an online tool that we use and that we offer to nurses where nurses can find all kind of information concerning the pathology and the treatment for MS. And it's an online tool that can be used not only for education, but it's also a communication to communicate for nurses and get informed by other ways like webinars and so on. Thank you.